Good morning, student. Today we discuss about very important topic, that is interpersonal relationship in nursing. We see the introductory part of interpersonal relationship in nursing. Human beings are social by nature and cannot live in isolation. It means human beings are naturally social, so they cannot live alone without contact with others. Next, interpersonal relationship IPR refers to the social connection and emotional bond between two or more people. Next, in nursing, IPR is the foundation of nurse patient interaction and an essential component of therapeutic care. It means IPR is a very important because it is the basic of nurse patient interaction and plays a key role in patient care. Next, effective interpersonal relationships help in communication, trust, healing, teamwork, and holistic patient care. It means good interpersonal relationships help in better communication, building trust, faster healing, effective teamwork, and providing complete holistic care to patient. Now we see the definition of interpersonal relationship. General definition is interpersonal relationship is a strong, deep or close association or acquaintance between two or more people that may range from brief to enduring in nature. In nursing, which is wrote by Peplo, nursing is a therapeutic, interpersonal, and goal directed process which functions cooperatively with other human process to make health possible. It means nursing is not just about giving medicine or doing procedures. It is a healing process that focuses on helping patients recover and stay healthy. It is interpersonal, meaning it depends on good relationships and communication between the nurse, patient, and others. It is goal directed, meaning nurses work with clear health goals in mind, like pain, relief, recovery, or comfort. Nursing also works together with other human efforts like doctors, family, support, and the patient's own effort to make good health possible. Now we see the characteristics of interpersonal relationships. IPR involves two or more people. It is based on mutual trust, respect, and understanding. IPR is a reciprocal. It means it is give and take. IPR is dynamic in nature. It is changes with time and situation. Communication is the key of every problem. IPR can be therapeutic or non-therapeutic. Now we see the types of interpersonal relationship. First one, social relationship. A social relationship is a built to meet social needs like spending time with friends, family, and neighbors. It is informal, meaning it is casual and not professional. It is not goal directed, meaning it does not have a specific purpose like treatment or work. It is mainly for companionship, sharing, and enjoyment. Next type is professional relationship. A professional relationship happens because of work or duty, like between a teacher and student, nurse and patient, or employer and employee. It is formal, means it follows rules and boundaries. It is role based, means each person has a clear role, like the nurse gives care and the patient receives care. It is a time limited, means It usually lasts only as long as the work or duty continues. Next type is therapeutic relationship. A therapeutic relationship is the bond between a nurse and patient. Its main purpose is to help the patient get better and reach health goals. It is time bounded. It means it lasts only during the care period. It is professional. The nurse keeps clear boundaries and follows ethics. It is always focused on the patient health, safety, and well being. Now we see phases of nurse patient interpersonal relationship by Peplo's model. The first, orientation phase. This is the first meeting between the nurse and the patient. The nurse tells the patient her name and explains what her job is. The nurse tries to make the patient feel comfortable and build trust. The patient talks about their problems, worries, or health needs. Second phase is identification phase. In this stage, the patient start to trust the nurse and share their problems more openly. The patient talks about their feelings and concern with the nurse. The nurse listens carefully and helps the patient understand what their main problems are. The next phase is exploitation or working phase. Patient uses available services to solve problems. It means the patient actively works with the nurse to get better. The patient uses the help and services given to solve their health problems. Next, nurses provides resources, teaching, counseling and emotional support. The nurse gives information, teaches, guides, and support the patient emotionally. Both the nurse and patient work together, and the patient takes an active role in their care. Next phase is resolution or termination phase. This is the final stage of the nurse patient relationship. Patient needs are met, means the patient problems are solved and their health needs are met. Relationship comes to an end. The nurse patient relationship comes to an end. Focus is on independence and preparation for discharge. It means the nurse helps the patient become independent and prepares them to go home or continue care on their own. Now we see the skills needed for effective interpersonal relationships. First, communication skill, being able to listen carefully, ask clear questions, and explain things in a way the patient understands. Second, empathy and compassion, understanding the patient's feeling and showing kindness and care. Next, respect and trust building, treating the patient with dignity so they feel safe and trust the nurse. Next, self awareness means knowing your own feelings and behavior so they don't affect how you treat the patient. Next is assertiveness, expressing your thoughts and needs clearly and confidently without being rude or aggressive. Last, conflict resolution skill, handling disagreement calmly and finding solution that works for everyone. Now we see barriers to effective interpersonal relationship. First one, language and cultural differences. Means when the nurses and patient don't speak the same language or have different cultural practices, it can cause misunderstanding. Next, prejudices and stereotypes. Having unfair or fixed opinion about someone can affect how they are treated. Next, lack of trust or respect. It means if the nurse and patient don't trust or respect each other, good care becomes difficult. Next, poor communication. It means not listening properly or not explaining clearly can lead to confusion. Next, emotional stress or burnout. It means when the nurses feels tired, stressed or overworked, it affects patient care. Next, patients denial aggression or withdrawal. It means sometimes patients refuse to accept their illness, become angry, or avoid communication, which makes it harder to help them. Now, we see importance of interpersonal relationship in nursing. For patient, builds trust and comfort so the patient feels safe with the nurse. Improve the patient's feeling and emotions, reducing stress or fear. Support the patient's healing and recovery process. Encourage the patient to take part in their own care and treatment. It means for good IPR for patient promotes trust, comfort and cooperation. It improves emotional well-being. It helps in recovery and rehabilitation, and it encourages patient participation in care. Now we see for nurses why it is important. Increases job satisfaction, making the nurse feel happy and proud of their work. Improves teamwork and cooperation with other healthcare workers. Help reduce stress and conflict at the workplace. Strengthen the nurse's professional role and identity as a caring and skilled helper. Now we see why it is important for healthcare system. Improves quality of care so patients get better treatment. Increase patient satisfaction as the patients feel happy and well cared for. Reduce mistake and confusion, making healthcare safer and smoother. Now we see nurses' role in building effective interpersonal relationship. First, establish trust and maintain confidentiality. It means make sure the patient feels safe and keep their personal information private. Second, show empathy and respect. It means be kind, understanding, and treat the patient with dignity. Next, encourage open communication. It means make the patient feels comfortable to talk honestly about their feelings and problems. Next, maintain professional boundaries. It means be caring and supporting but keep the nurse patient relationship professional. And next, provide emotional support without becoming over involved. It means support the patient feeling but don't get too personally attached. And last, adapt interaction according to patient's age, culture, and conditions. It means communicate in a way that suit the patient's age, cultural background, and health situation. We cover the point in this lecture: the introduction of the IPR, definition of interpersonal relationship, characteristics of interpersonal relationship, what are the types of interpersonal relationship, what are the phases of nurse patient interpersonal relationship, what skill needed for effective interpersonal relationship, what is the barriers to effective communication, or effective interpersonal relationship? What are the importance of interpersonal relationship in nursing and nurse role in building effective IPR? So we see the conclusion of this topic is good interpersonal relationship between nurses and patients are the center of nursing. A caring and trusting relationship built on trust, empathy, respect, and good communication helps patients heal and stay healthy. Nurses need to build strong interpersonal skills so they can give the best care to patients and also grow in their profession. Thank you. Have a nice day.